Hey guys, it's me again, Dr. Kathy, here to talk about the next important sex hormone, estrogen. Estrogen is a female sex hormone. You have it, I have it, we all have it. The question is, how much of estrogen do we have? A little bit or a lot? All right, guys, you guys should have a little bit. We women should have a lot of estrogen, right? Now, remember, what's a lot and what's a little? All right, so we have reference ranges. You can get your estrogen level checked. Guys, you've got to get your estrogen level checked. Yes, testosterone is your number one hormone, but estrogen can affect your testosterone. It can actually destroy your testosterone if you got too much of it or if you have too little. So you guys need some estrogen. Very important. Women, ooh, we know we need our estrogen. Without our estrogen, we have our hot flashes, right? We go into that change. And yes, sometimes some women go into the change very early. That's called premature menopause, right? And then you have the ovulation and you have no chance of having a child, right? If you have premature um, menopause. So the bottom line is ovulation is dependent on estrogen, right? Progesterone. Estrogen, not testosterone, estrogen, progesterone. So you guys need to understand what is estrogen. It is a female sex hormone that you guys have a little bit of, and we have a lot more than you. Okay? So what does it do? It's very important in guys in producing sperm. Yep. There's a whole lot of processes that go on that now end up in you making good sperm. If you don't have the right amount of estrogen, the right amount, and it is very delicate, you cannot make sperm or you'll make bad sperm. Erectile function. In order to have that function in the penis, you've got to have a certain amount of estrogen to give you that function in terms of the vessels, the smooth muscles, right? The arteries, the veins, everything's got to be working nice. And estrogen is part of that. Estrogen actually gives the muscles the ability to open and close, relax and contract. So you've got to have good estrogen levels, men, okay, to do that sexual function. And of course, libido. So the estrogen actually goes to the brain and it's formed in the brain. All right. So it's formed in the brain, it's formed in the muscles, the fat, which is why when you're very much overweight, you store a lot of estrogen, which is not good, guys. Okay. And gals. Okay. It makes you gain weight. So you don't want to have too much estrogen. And how are you going to find out? By measuring it. Okay. So, yes, your ovaries in women make estrogen. The testicles make some estrogen. About 20% of estrogen is made in the testicles. Then the rest is made in the brain, the bones, the fat. Okay. Women, we make it in our corpus luteum, we make it in our ovaries and in our adrenal glands. Okay. So we have a certain amount, sometimes 300, but 400, 500 might be too much. And then you become too dominant with estrogen. That's in women. Men, I don't want you more than 30. If you guys are 35, 40, 100, I've had some guys 300 estrogen, all coming to them from numerous factors. Weight, number one. Okay. I don't want to go too much into other sources because the question is what does not increase our estrogen levels? All right. So, right now, our environment is increasing our estrogen levels. I had mentioned before that over the generations, testosterone is going down. Some people think it's because of what's in our environment, what we're eating, right? We've got all these chemicals, right? Phthalates, right? BPA in plastic containers. So, guys, gals, try and use glass, not plastic, because it has a lot of chemicals that will seep into your food and lower and interrupt the hormones and cause tremendous problems including cancer. Okay, so we want to stay away from synthetic preservatives, synthetic plastics that have additives and will actually hurt us in the long run. Okay, yeah, I don't want to keep on going on. It's pretty scary because a lot of our foods, the wheat, the barley, the oats, our fast foods, our snacks, cookies, cakes, everything is just full of some chemicals that interrupt and affect our estrogen, meaning that we can end up with very high levels of estrogen or very low levels of estrogen, depending on what we're exposed to. Okay? So, soy, guys, gals, stay away from soy, especially the processed soy. Please stay away from it. Years ago, soy was okay, but now soy is not to be touched by my men. It increases your estrogen levels. Okay? I don't want it too high, I don't want it too low. Get it measured, right? Also, your weight. All right. The guy that was over 300 with his estrogen level was over 300 pounds. Okay, so we stored all this estrogen in his fat, and that is where your testosterone converts to estrogen. So a lot of testosterone converts to estrogen in men and women, but more in the guys, of course. Which is why when guys come to me with high estrogen levels, I will take it down. I'll bring it down within the normal range. But again, you got to be careful. You don't want it too low. You don't want it too high. You need estrogen. Okay? So some of those chemicals that are interrupting it are actually doing this as we speak. We don't even realize it. So get your levels checked and find out whether you're too high or too low. Now, there is a urine test that I do in my office, and I can actually check and see what the metabolites are from your estrogen, which means how you're breaking down your estrogen and how is it being formulated in terms of the metabolites. Are you making one more than the other? Because there are some that are more dangerous than the others, right? Because they do say some of the estrogen can cause breast cancer in women, prostate cancer in men, and cancer in general, depending on what type of estrogen you're making, right? So we've got to be careful. The foods we eat can cause cancer, right? So we've got to be careful because they have all sorts of junk in it that we don't realize, right? Pesticides, right? Even some of our household cleaners, right? We've got to be careful. We should be using more natural cleaners nowadays, right? Pollution out there, right? All the toxic metals that we can be exposed to, lead, mercury, they can interrupt with our hormones and make estrogen bad or good for us. But we need it, right? Women need it for the sexual organs. We need it for our lubrication, right? You guys need it, right, for sex. We need it for the sexual function, for muscle and circulation, for the genital areas for guys. But for women, we need it even more because that's our main hormone. We need it for skin. We need it for hair. So if your estrogen is out of whack, you're going to lose your hair, women. You're going to lose your hair. And it is unreal. People don't look at that. We are not trained to look at estrogen levels. But women lose hair because of estrogen imbalance, too high or too low. Okay? So getting that balance is important. So you're going to see a doctor that knows how to balance your hormones and know exactly what you need. Uh, there's different tests we do for the estrogen levels, but the most important thing is see someone that knows how to evaluate you for your estrogen level, guys and girls. Um, so when we women don't have a lot of estrogen, right? That's normally what we call menopause, right? I call the guys andropause when they go into that age where they're imbalanced, low testosterone, estrogen goes up, right? As you're getting older, as testosterone goes down and all the bad things go up for both of us, right? So we want to make sure our hormones are not too low and not too high so we don't go through that yo-yo up and down state of mind, right? Depression. Remember I said depression is good for depression. And so estrogen is also good for depression. It's good for anxiety. Estrogen helps you stay calm and it's good for sleep. So if you're not sleeping well, it might be estrogen because estrogen is important for the brain. We need the brain not to shrink. It will shrink without estrogen and testosterone, but especially estrogen. It's protective at a certain level, not too high, not too low. In women, we get a lot of fibrocystic breasts, fibroids, cysts from too much estrogen, right? All that weight in the hips and the thighs, right? Sometimes in the stomach, estrogen dominant women, right? And we're getting into trouble there because we can end up again with breast cancer or female ovarian cancer, organ cancer, because this is a hormone that attacks those organs in women. And in guys, yeah, you can get cancer too. Watch out for the prostate, okay? So whenever women are going through that low hormones, it's very common because you guys cannot recognize your partner, right? We tend to become very different when we go through menopause. So please, I've said it before, No divorce until you check your hormones. Please check your hormones. Make sure that they're balanced before you consider divorce, because a lot of people are going to divorce with crazy hormones, and they go into the next relationship with crazy hormones, and it's not going to get any better with that crazy hormone imbalance, okay? So you want to check your hormones and make sure you're going into the new relationship or staying in your present relationship and giving each other a fair chance at being happy. Because with these hormones out of whack, you will not believe it. The fatigue, right? The irritability, the depression, the mood swings. Oh my goodness, you can go up and down because the hormone estrogen actually is related to serotonin and GABA. And that's important for your brain. So when you think someone is crazy, yeah, it might be crazy from chemical imbalance, but it also might be crazy from hormonal imbalance. Okay, so the hormones got to be checked and the chemicals have to be addressed. It's hard to check chemicals, but you got to address both, right? Psychiatric evaluations, psychological evaluations, and hormone balancing and hormone evaluations. And again, that will involve your diet, because if you don't eat well, you don't exercise, you're not going to make good hormones. And you need good hormones to feel good and enjoy life and improve your quality of, sex and your quality of life. Okay? All right. So what do we do if we have a low estrogen level? All right. So my guys, if you have a low estrogen level, I am going to definitely do something to bring it up. Not that you guys have to have a very high level. Like I said, around 20s, 20 something, not more than 30. And I will definitely either give you some herbs or some supplements to help bring that back up. But I want the good estrogen, not the bad estrogen. Okay? Now, if you have too much estrogen, which I see more of, most guys come to me high estrogen, and I'm putting them on something to block that estrogen conversion from testosterone to estrogen. All right, so I've got to stop it, block it. Some guys will know about this. It's called an estrogen blocker, and there are natural ones and there are prescription ones, depending on how high you are. Okay, so again, I do have guys on estrogen blockers, both natural and prescription, because they are actually walking around eating things they shouldn't eat, and they won't stop. I know you guys love food. I know you love your southern food especially, but you've got to realize that some of those foods are dangerous to your estrogen. So you've got to learn to slowly walk away from them, or at least get on something that will bring down those levels, okay? So when you have that low estrogen, it will not allow you to have good sex, guys, okay? So don't think that estrogen is going to make you a female. Oh my God, I said, Dr. Kathy, am I going to turn into a woman? Am I going to become female? The answer is absolutely not. You are not going to become female, okay? If you were going to become female, you would have been female a long time ago. You would have been a woman dressed, cross-dressing, and becoming more feminine and effeminate a long time ago. But it will give you some feelings of being like a female. And okay, so again, depending on how high you are, right, it's going to be more the higher you are. Now, of course, those individuals that are trying to change their gender are taking enormous amounts of hormones. So I'm not talking about them. I'm talking about the ordinary person that's not trying to do that. You're going to see that you're going to feel a little bit more confused. Brain is not working as well, foggy, memory is not that great, men and women. Okay, so you want to make sure that in the guys, your estrogen level is not too high. And if it is, I'll bring it down with the blocker. Now, the opposite is true for women. Women, I want you higher. I don't want you low. Because when you're low, vaginal dryness will interrupt sex all the time. Oh, God, it hurts. Yes, it's going to hurt because you don't have good muscle tissue down there. We need good muscle strength down there. And the pelvic floor, all that needs estrogen. All right, your bones, your muscles, your skin, everything needs to be fed estrogen. Again, not too much. Yes, the fear of breast cancer, I know. Breast cancer, I truly believe, is caused by not just hormones, but again, by all that toxic stuff in our environment, right? All the chemicals and all the, the I'm going to say preservatives, but I'm going to say poisons, right? Even the mercury, the arsenic, the lead in our fish, in our food, right? The meat, the dairy, they put hormones in there that we should not be exposed to. Synthetic hormones that will enlarge and make the meat and the chicken bigger, but it's going to make us sicker. Do they know this? I don't know. I'm just going to say I plead the fifth on that. I do not know. But I do know that you've got to do more organic. You've got to do more grass-fed meat, right? When I say organic, at least clean, right? Shop and go to places where food is not well, I'm not gonna say untidy, but unpalatable, right? You want to see the food looks good and healthy. But if it's too big, then you're gonna say, oh gosh, did they put some hormones in there? Yes, they probably did, right? So watch out for those foods that are just too big to be true, right? Um, yeah, grilling and burning your foods to black is dangerous. It is producing some horrible chemicals that are cancer producing. So please stop that. It interrupts your estrogen also. So please don't burn them black. Make them a little bit brown. Maybe it's a bit crispy, but that brown, crusty, tasty, I know, part is dangerous too. So please, if you do it, don't do it much. Steam, grill and bake, please. You can saute in olive oil and stuff like that too. Be more careful with what you're eating, especially as you get older, because the hormones become more dangerous as we get older because the imbalance is worse, right? When we're younger, the young guys, they too can have problems with estrogen too. They can get depressed. They can have uh, erection problems with men. Women too, we can have imbalances. My youngest girl was 15 with estrogen that was imbalanced with her progesterone. So very important to know if you're having any issues that are a little bit more than ordinary, right? Get your hormone levels checked. Estrogen, testosterone, and I'm going to talk about progesterone next time, okay? But estrogen is important for the lubrication of the skin, for the beauty of the woman. That's why we're so curvaceous, right? Because we have estrogen. You have testosterone, which is why you're more manly in terms of your shape, okay? But we women, if we get too much, it can hurt us. So, do you have too much estrogen, women? Do you have too much estrogen, men? If you do, let's fix it. Okay? All right. Treatment would be, if you're low, getting some pellets, getting some injections, getting some creams, again, from a doctor that knows what they are doing. If you get too much, it's going to be dangerous, right? And you have to be balanced with progesterone. You never take estrogen by itself. Again, this is all un um, how do I say it? This is not the normal medical training that doctors get. This is more in the holistic training or functional medicine world. So you're not going to hear a lot about it from regular doctors. So you've got to see a doctor that understands the functional medicine aspect of medicine. And please don't be tricked. These are doctors that sometimes think they know what they're doing, but they don't. So please watch out and make sure you're seeing a doctor that has experience for years in this area. Okay. But these creams, these injections, these tablets, these pellets can be used to improve testosterone, mostly in women. I don't really give estrogen to men. They don't really need much. All you need to do is just figure out what's lowering their estrogen and then fix it with its food or some medicine that they're taking. Antidepressants can do this. Um, uh, Birth control pills can do this, right? So you have to be careful with those medicines that can affect it. And even some herbs and some supplements that you're taking can affect your estrogen. So be careful. All that over the counter stuff, you should show that to a doctor and make sure that they know what you're taking because that can affect your estrogen level too. So bring in all your supplements and all your medications for a functional medicine doctor or a doctor like me to figure out what you're taking to see what is interrupting your estrogen levels. Because guys, you need some estrogen. You never knock it down to zero. I had a guy once, he knocked it down to zero. I'm like, why are you knocking it down to zero? Oh, I don't want to get breast. Yeah, that's one of the side effects of getting a lot of estrogen, guys. You get breast. And I'm like, yeah, but you don't have breasts. So why are you taking? Oh, you don't want to get breasts? You don't have breasts. So leave it alone. So he got off that supplement and his estrogen level came back up. So just remember, we don't want it too high, guys. Women, we need it a little bit higher, of course, because we're women and we can do the creams and the pellets and the injections and stuff. But again, see a doctor that knows what they're doing. Get your advice from a medical doctor or a practitioner that knows what they're doing. So I know I say medical doctor a lot, only because I want someone to supervise that because they have in-depth training in this. Yes, the nurse practitioner can, but we as doctors, we have the sky's the limit. We can do a lot. Nurse practitioners, PAs, other doctors, they have to be answerable to doctors, yet they are very smart. They can be extremely intelligent, but you do want them working with a doctor because they have to generally have that I'm going to say collaboration. Okay, so again, estrogen very important. Are you hurting yourself by eating certain foods? Are you hurting yourself by exposing yourself to dangerous chemicals that are lowering your estrogen? You can find out, okay, by seeing a doctor that can actually test you, do a urine test, blood test, Hair analysis, we do a hair analysis, saliva tests to find out what's going on. But please, if you're not doing well, whether it's sexually, whether it's with energy, focus, memory, yes, you're going to have to get a psychological evaluation to check for ADHD, to check for anxiety disorder, to check for mood disorder, to check for bipolar disorder, to check for depression, and that suicidal ideation, schizophrenia. We have to get that checked because that could be a chemical imbalance, but you could also have a hormone imbalance. You could have both. You could have one more than the other. So please, if you get that checked, you're going to feel a lot better when it is addressed and treated. Okay. All right, guys. Ciao. I'll see you tomorrow. Good night. Bye.